Good morning, everybody. Now what's happening?
Steve, you have to stay muted.
Mine's muted here.
Yeah, I just muted it again.
Okay.
Good to go.
Good morning, everybody. Today is the Board of County Commissioners of Pickens County work session on November 10th, 2020. In here in the room with me are myself and Patty Clapper, commissioners, Connie Baker from our finance department, Terry Anderson running the IT for us, and John Peacock, county manager. And at home today are Vice Chair Kelly McNicholas Curry, Greg Postman, and George Newman. So today, this morning, we are looking at two different budget items for the 2021 budget. The first one is the district attorney's budget presentation. And Connie, are you going to start this and then we'll hand it over to the district attorney?
Yes, this morning we have from the 9th Judicial District, District Attorney Jeff Cheney and his staff here to present their proposed 2021 budget. I'll let them take it away.
Good morning. I'm going to remove my mask briefly so that I can speak clearly. I'm honored and grateful to be the district attorney for the 9th Judicial District representing Garfield, Pickens, and Rio Blanco counties. I want to thank the commissioners and the county of Pickens for giving us over the years. We are very grateful for the facilities to provide and the contributions that you
Steve,
make.
we can't understand.
Jefferson? Oh, she's unmuted.
Yes, sir.
No. Jefferson, could you get a little closer to the mic, perhaps?
Yeah. You bet.
Hi.
Can you hear me better now?
That's better.
Oh, I'm so sorry. Okay. Well, I'm honored to be the DA for the 9th Judicial District representing Garfield, Pickens, and Rio Blanco counties. And I want to thank Pickens County and the commissioners for the support that you've given us over the years. We appreciate the outstanding facilities and the contributions that you make. I'm joined by Office Administrator Bill Brunworth behind me, and then Steve Iran, our Victim Witness Coordinator, is there. We have presented a budget this year that is reduced, that is less than last year's budget. I would just highlight some of the noteworthy provisions in the letter that I submitted to you all some time ago. This year, our budget is a total of $3,658,024. That's less $127,244 that is contributed by the state of Colorado for the DA salary. This is a reduced budget over last year of less than 1%. As it relates to Pickens County, it is more than 1%. We've asked this year from Pickens County for the contribution that Pickens County makes is $723,282. Last year it was $731,230. As you know, we have been operating in the same challenging environment as you have. I see some of you are at home. We have not ceased operations over the last year, although jury trials have not been occurring due to space limitations inside of our courtrooms and the social distancing guidelines. Our courtrooms, none of our facilities, frankly, were designed to operate in a pandemic that requires social distancing and mask coverage. But we're adapting and we're continuing business. In terms of crime, I would tell you that crime was down, obviously, in the beginning of the year due to folks staying home. That started to rise again in August. Statistically speaking, we're starting to get up to our average numbers in terms of crime. Some of the highlights of our budget, I would tell you, are IT. We continue to, I see, George, you waving your hand. Can you not hear?
I'm not sure George can hear or can't speak. I don't think he can hear.
Uh-oh.
I think that's
Is
probably
everyone-
on George's end.
He had put a thing on the chat saying he couldn't hear, then he went off, then he came back on. I don't think he can hear yet.
I'm chatting with them now, but everyone else is on.
Can you hear now, George?
Yeah, okay, thanks.
Okay, George is good.
Thanks, Terry.
Go ahead, Mr. Cheney.
Thank you, Steve. Some of the highlights of the budget are our IT, our victim witness, and our Garfield County separate. All of you were here last year, so I understand that you probably understand some of those highlights. But just to be brief, we are suffering a reduction in federal contributions to our victim witness program. That is due in large part to some of the reform that is allowing fees and fines to be waived, and those fees and fines were contributions to a pool of money that was distributed to victim programs around the state, and that has been reduced. So we're tightening our belt to try to continue the services that we have offered to victims in the district. We also are facing IT challenges simply from a storage perspective. As you know, Senate Bill 217 now requires all law enforcement agencies in the state to utilize body-worn cameras. I think that's a good thing, and I'm frankly happy about that. It is a challenge, however, in terms of storage and the labor that it takes our team to review all of the body camera footage. Obviously, we have to have an exercise of due diligence in each case and make sure we review all of that body cam footage. And so that's adding additional time that has to be invested by the prosecutors to prepare their cases. I would be remiss if I didn't at least praise the team that I have. I'm frankly really honored and blessed to have the team that I have. And our team works hard. They've worked hard with the challenge of the pandemic and continue to adapt and overcome and try their best to keep our district safe. Don Nottingham is one of our chief deputies now. He was promoted earlier in the year, and he's stationed in Aspen and District Court. And then we have Louisa Burney, who is in County Court, and then we have Laura Maylene as our victim witness and legal assistant there. We're really settling into the facilities that you all spend a great deal of money for, and we're really, I mean, every day we go into that office, we're really, really thankful for getting out of the basement and having accommodations that are suitable to meet with victims and to conduct business. So I'm really thankful again to you all for considering our budget request this year, and I would respectfully ask that you approve it. Pending your questions, I'll close at that point.
So Jefferson, you had spoken about the two-car situation for your office, where one of them's been converted to more for investigations, leaving you with just one car for getting around the district, which is a large district, obviously. Given the pandemic, you probably aren't driving as much as you would be if the pandemic weren't here, but are you doing okay with just the one car for your district attorney's office transportation? Or are you using the other one, the investigative one, sometimes just to get people to a different courthouse or something?
Really good question, Steve. You might recall, or maybe you forgot, and maybe I didn't highlight it in the past, but Garfield County actually donated 2 additional cars to our fleet. So we now have 4. And you're right, we're not traveling as much. I just got out of the car this morning, and I had logged almost 300 miles since Friday. Of course, I've been going up to Rio Blanco County, handling the court up there. We haven't been traveling as much, for sure. But since we have 4 cars now, that challenge is not as great as it used to be. But I appreciate you paying attention to that concern we had in the past.
Okay, well, if you were really strapped for a car, I was gonna see if we could come up with a solution of some kind. But it sounds like you're in good shape there.
I got a couple of college students who break down every other week, so if you know any leads on a car, I'll follow up with you offline.
Christian, questions from the other commissioners?
Steve?
Patty?
Yeah, I just want to thank you and your office. You guys do a great job. You know, I speak with Mr. Hershey kind of on a regular basis, just because we're longtime friends, and keep supporting him in his efforts, and especially with what we're being faced since last March. But I am perfectly comfortable. I mean, do we not accept a budget that's a little lower than last year's? I don't think we don't just fully support you and move forward. So thanks again, Jeff, and the rest of your office. And I want to personally say hi to Mr. Brunsworth, who I haven't seen in a while. Hi, Bill.
Thank you, Patty. I really appreciate it, and I'm glad to know Tony has a friend.
Okay, any other questions right now? Greg?
No questions. I'm fine with what I see here, and I just wanted to congratulate you on your reelection after a brutal campaign.
Hey, yes, I'm still bloodied a little bit, but not bowed. Thank you, Greg.
So Connie, are you gonna go over the budget details on that budget sheet?
I can go over that if you'd like, or,
I mean, I'm comfortable with the budget the way it is.
Yeah,
You know, the first go-around on the DA's budget, there are always questions for a new commissioner, but we've all been through it and I think understand the differences in this budget with the separate Garfield County budget pulled out there for part of it, and all that could be confusing on someone's first take on it.
right. So the total shared expenses are $3,558,000. Those get split between the 3 counties, Garfield, Picken, and Rio Blanco, based on population. And in your packet, there's also an updated sheet with the new population numbers. So that determines the amount that Picken County is paying. Then there are state contributions of $127,000, so the amount that we pay gets reduced a little bit, from $750,000 down to $723,000. And again, the district attorney's office did a good job this year of trying to cut wherever they possibly could and trim, really getting down to as tight of a budget as possible and actually have an overall decrease in their budget. For Picken County, I think our population was down just slightly from the prior year, which meant that we even had a little bit more of a decrease than what's shown on this spreadsheet. And if you have questions on different parts, different expenditures shown on this sheet, I'm sure that Bill or someone from their office can explain them. Do the commissioners have any specific questions on the budget?
I'm good.
Let's see, don't see any questions, Connie.
Okay.
One thing that I was impressed with was the type of computer system you have to have in your office for tracking all of the discovery, which could be an immense amount of material. And I don't know what kind of, I don't totally understand your system, but realize you have to have a huge storage bank, because you have to basically store this information for forever, if almost forever, if not forever. So going forward with having to do all of the video cam stuff and all of that, which would take up a huge amount of storage also, do you anticipate having to somehow do a different system or pay a lot more money into just the storage of the information?
Yes, Steve, we anticipate increases to the cost of the hardware to do the job. And then also, we've operated with mere one FTE in our entire IT, and that's really hard, and he works extremely hard. And we've, obviously, if we hadn't have had a COVID, I've seriously considered asking for at least a half FTE for our IT. But given the challenges that we've all faced, we tightened everywhere that we possibly could. We looked at the line items that we have in the budget that you saw there, and thank you, Connie, for highlighting that. I should have done a better job of that. I just thought you all were familiar from last year, but the items that we saw that were not expended at 100%, we trimmed. And so that's what we tried to do to present. I mean, it's a down to the bone budget, I would tell you. And it's as lean as I think we can do our job effectively. But the cost relative to the body-worn camera is definitely going to hit us in the IT department. And frankly, I think it's going to hit us in just prosecution labor power, person power. To do all of the work, because you can get a simple misdemeanor case and have an hour and a half of video, and 80 minutes of that may not show anything, and so you're focusing in on 10 minutes. So we're challenged by that, but I think the benefits of body-worn cameras far exceed any sort of hassle or inconvenience.
Okay.
I think, Kelly, you had your hand up, yeah.
Kelly?
Yeah, you started to answer my question, which was if Senate Bill 217 had any additional implications for your office. You've talked about the body camera footage and the need to store that. I was wondering if there was anything else for your investigations team or your office otherwise?
Really good question. It's an extensive bill. I think a lot of what was in the bill is really helpful for enhancing the integrity of law enforcement and how we do our job. It has affected our training, because what we did was we wanted to make sure that we presented Senate Bill 217 to all of the law enforcement agencies throughout the district, and I'm really blessed to have such a great team of prosecutors who have a heart of a teacher put together a really great presentation that we've been able to leverage technology. So we've actually presented via Zoom, Teams. We use Microsoft Teams. And we've presented that thoroughly throughout the district. And obviously, law enforcement needed to know some of the nuts and bolts of 217, because there were certain things that had to be done by certain time frames and certain things that they needed to do to make sure that they're operating congruent with that bill. So it's affected us only in terms of the technology that we're going to have. It also, one of the main challenges of Senate Bill 217 is the requirement to release video in a certain time frame, and sometimes cases are still being investigated, and that poses a challenge for prosecutors that, we're still investigating, and so we sometimes want to safeguard that video footage so that other things can be done to follow up in the investigation, and now we're required to release that by a date certain. So that's affected us somewhat, just to sort of reshape our paradigm of how we see releasing video prematurely in our minds from the old way that we looked at things. But beyond that, those are the primary changes.
Thank you.
Thank you.
Okay, Connie, this is, we don't have a decision point on this today, is that correct?
That's right. It's included in the general fund budget for Picken County. And when you approve the general fund budget, you will also be approving this as part of that budget.
Okay.
So today is just your go-ahead, proceed as planned.
Yeah, I think, I mean, we could do a thumbs up. I think everybody's pleased with your budget. We all have tight budgets this year, more so than other years, and we really appreciate that you've been able to hold the line on yours and actually reduce your budget a tiny bit. Knowing that going forward, the day's gonna come, we're gonna have to increase your budget, I think, for, you know, additional people or additional costs or whatever, but it's, for this year, it looks like we're all good.
Yep, I'm good.
We are really appreciative of you all giving us time to present the budget, and we don't take for granted $1 that you all contribute. So thank you so much, and I think it's a testament to the team that we have up there, the contributions that you make. You should stop by and meet Louisa and Laura and Don. They're just phenomenal people.
Okay, so thanks, Jefferson, and thanks to all of your staff for the work you do. We really appreciate it here. And we're glad that we're able to provide you a little better digs in our courthouse too. I haven't actually been in to see your office since the remodel was done. I'll look forward to seeing it someday.
Yeah, the radon meter is not pegged out as much upstairs as in the basement. I'm kidding. No, you should stop by. It's a great facility, and we definitely have had victims feel at home and comfortable in that space.
All right. So thanks for being here today. We appreciate it, and it'll be a short drive back to your office now after our meeting.
I think it's about 26 steps, but I'm sorry I couldn't see you all in person. I look forward to the day when we can congregate again and see each other. Happy Veterans Day, Steve.
Thank you. Bye. Okay, moving on to our next item is the Healthy Community Fund Grant Review Committee recommendations. And Lindsay, are you carrying this conversation for us?
Sure am, with the help of some of our Citizen Grant Review Committee, as well as Lisa, so thank you. Great, thank you. Is that Connie controlling that? Thanks. Appreciate that. So, wonderful to see everyone again. I feel that it's been a privilege to see you all a couple of times in the last month, even though it's over Zoom. Though it's been somewhat of a tough year. This is really what's so nice about the Healthy Community Fund is that it's an opportunity for us to really show our gratitude to our local partners and nonprofits and support them through this opportunity. So we just feel really lucky. It's such a cool thing, and I imagine we're going to have some of our Citizen Grant Review Committee trickling in. They've been asked to attend at 10:30, and we also have a couple of nonprofit partners to answer some questions as well. You can go to the next slide, Connie. So before Lisa gets started, I just want to ask you all either have the spreadsheet in front of you of all of the recommendations that the Citizen Grant Review Committee are making. And I just ask that you hold off and just wait until we get through some of the overview of the fund so you can see some of that before we dig into the actual spreadsheet. We will do that in a couple of slides, but because we only meet with you once a year about the Healthy Community Fund, we want to just remind you what it is, kind of give you the overview of what we've been doing and where we're at. So Lisa, is Lisa on the call? Okay. So I was handing it off to Lisa and she wasn't on the call. Okay, I'll take the first slide then, no problem. So the Healthy Community Fund, just to remind you what it is, it's if you don't remember, it's a dedicated property tax that was established in 2002 and then went up for revote in 2006, 11, and again in 2018. We got a 9-year approval this time, so the next time for renewal will be in 2027. The mission of the Healthy Community Fund is to help Pickens County citizens and employees be independent, healthy, and safe by supporting local nonprofit organizations that provide critical health and human services and community resources. The ballot language breaks into 5 different goal areas what Healthy Community Fund actually funds. Those 5 areas are family and youth well-being, physical health and public health, mental health and substance use prevention, the well-being of seniors, and cultural treasures and environmental quality. That is what the ballot language refers to, and that's what we end up funding by certain percentages. This year we had a wonderful citizen grant review committee that consisted of Molly Brooks, Barbara Reed, Brenda O'Connor, Stephen Wick, and Lupita Ortiz. She was a senior, and she's a senior at Aspen High School who was absolutely amazing in her contribution to the Healthy Community Fund this year. It was so fun. She's going to be on, if she's not already on, she's going to be on very soon. So you'll get to meet her. The allocation methodology of the Healthy Community Fund, just to remind you, is that the highest priority for funding goes to agencies providing basic health and human needs. Other funding will be allocated based on availability, and the percentages are that 22% of the fund go to core public health functions, 46% of the fund goes to nonprofit health and human services organizations, 15% of the fund goes to senior services, 12% go to community nonprofit agencies, and 5%, up to 5% can go to Healthy Community Fund management of the fund. So the resolution is what prescribes the percentages to allocate, and this drives how the Citizen Grant Review Committee reviews the grant. Okay, let's go to the next slide. Connie, I'm gonna let you take this one.
Yeah, so at the beginning of the budget season, before the Citizen Grant Review Committee starts their work, we estimate what they will have to work with for that particular year. So we start with the revenues, the estimated property tax, 3.28 million. And then there's a motor vehicle single occupancy tax and interest income for a total revenue of a little over $3.3 million. There are a few items that get taken off the top. There's the state mandated treasurer's collection fees, about $164,000. And then we always put in a little tax shortfall contingency, knowing that there could be abatements that happen during the year. Subtracting these, that leaves us with a total of $3,176,000 available to allocate. We then apply the percentages that Lindsay mentioned to that $3,176,000 to have the starting numbers that the Citizen Grant Review Committee can look at to be able to fund the different needs for that year. We also take a look at the projected fund balance at the beginning of the budget year. In this case, that's $130,000. There have been years where the fund balance was built up a little bit and the fund was able to tap into fund balance to allocate more than what was available. Other years, they will allocate a little less and build up the fund balance for future uses.
Thank you, Connie. So the numbers this year, we had made estimates, and because of COVID, the State Division of Property Tax let us know that the certification of property values was going to be a little bit later than we expected. So we did the best with the numbers that were estimated in the beginning. And that included also what we were doing for some of those core functions like integrated healthcare and things like that. So the numbers, they look a little bit funky this year, but we were able to get to a place that we feel really good about. So just to go over the overall impressions of the fund, sorry, somebody say something? Oh, okay. So really high level overall, the impressions were that this year, the Citizen Grant Review Committee was tasked with some really difficult decisions, as the Healthy Community Fund had a $240,835 higher demand this year of amount to fund versus the actual amount that was being requested. The Citizen Grant Review Committee recommends that us, the Healthy Community Fund staff, consider how to improve the process of applying for Healthy Community Fund so that the need for the funds granted is better demonstrated, so it can help inform decisions for nonprofits who are applying for the fund. The CGRC has concern with the amount of funding that continues to grow in the mandated, and when I say mandated, I'm talking about in those allocations, we have certain amounts that are going towards core public health functions like and community health services, our senior services, the money that goes to detox at Recovery Resources, the mental health and substance use with Mind Springs Health and Mountain Family Health, our integrated health care that goes for Mountain Family Health. So that number, we're seeing kind of a steady increase, not substantial, but steady enough. It's about, we're seeing about a 1% decrease over the last 4 years of how much discretionary amount there is to fund to our local nonprofit organizations. So that became really apparent this year, of course, because of the requests versus how much we were actually able to fund. So though it's still going to critical services, such as Mind Springs, Mountain Family, and things like that, what there was tension around was that there wasn't a ton of oversight from the Citizen Grant Review Committee of what's happening within those contracts. So many of those contracts, as you remember, have RFPs. They've gone up for business, where we have organizations that are held to a higher accountability of the funds because of the contracts that they hold. And just recognizing that there is this higher accountability of it, but that the Citizen Grant Review Committee is not seeing that. So we need to really work on tying the accountability of those funds to the Citizen Grant Review Committee so that they're aware of what's happening, not necessarily that they're making recommendations around it, but that they have awareness of what's happening with that money that's going towards those mandated funds. It really has shown us, I think, the opportunities that exist within this fund. So an example is the mental health contract that went up for RFP. We have much greater accountability of that money, and as we see bigger and bigger requests through the Healthy Community Fund, it's certainly giving us an opportunity to look at how we approach some of those bigger requests. Next slide, please. Okay, so the recommendations of the Citizen Grant Review Committee, Because they were tasked with such difficult decisions around the amount, they made the most equitable decision possible, which was to cut across all annual and new applications 20% the request, and that was to meet the demand issues that we were looking at with the estimates we were given. The Citizen Grant Review Committee reports that they've never had in their tenure on the committee, they've never had to make a decision like this. As in past years, most requests, very rarely did a nonprofit receive less than they had been given the year prior. Given the current landscape with COVID-19 and the increased need for prioritized services, the Citizen Grant Review Committee would like further clarification on the application and the scorecards around demonstrating need through their financial information. This is really one of the themes that came up, or one of the trends that many of the organizations are reporting their assets and reporting a pretty high number in that question, and what they're wanting to add is a question, something that recommends language change, something like describe the need and demand for your service funding request, or something like what services would your organization not be able to fund if you were not awarded this funding. The Citizen Grant Review Committee would like the Board of County Commissioners to consider the way that homelessness is being funded. It was one of the Aspen Homeless Shelter requested over $200,000 this year. This was the largest request that we've ever seen. And the Citizen Grant Review Committee was unsure how to approach that, and is wondering if there's another way to look at this, possibly an RFP process for a homeless shelter. The Citizen Grant Review Committee would like for us, the staff, to get really clear about a process for goals and outcomes and more clearly demonstrate impact. And I think that's also it's kind of the theme that we're hearing through the Healthy Community Fund this year, which is there wasn't enough money to meet all the requests, and we want to see better, we like to see need illustrated better. And one of the ways we can do that is how we're actually measuring impact of all of the different goal areas. So to date, the way that we're doing this is we ask organizations that receive over $10,000 to provide outcome measures. We're currently working with we're implementing new software for the grant, and we're working with our vendors around what is best practice for measuring impact with human services, and how can we do this well and succinctly, so it makes the Citizen Grant Review Committee's job more clear when they're making decisions around funding. And then lastly, you're going to see that there's leftover funds because the 20% cut still left a gap between, it left us with more money. So you're going to see leftover funds, and the Citizen Grant Review Committee would really like to consider how this money is being spent for future uses, especially as COVID-19 is ramping up again, and there may be more opportunity for response to help support nonprofits in our region around that. Okay, let's see. Okay, next slide. All right, Lisa, this one's you.
Hello. The Citizens Grant Review Committee is recommending funding of $1,206,000 for 66 agencies for next year. And there is $94,289 in available funding not awarded, and it is being reserved for future use. The Citizen Grant Review Committee implemented, as you heard, a 20% decrease for all annual and new applicants this year. We received 3 new requests to the Healthy Community Fund this year. All 3 of them are in Goal 5. They are the Aspen Chapel, Aspen Historical Society, and Huts for Vets.
Thank you. So this is the opportunity, now that we've kind of gone over the overview, recommendations from the board, now let's really dig into the spreadsheet. Yeah, and any questions before we get started digging into, yeah, I see Greg. Yep, go ahead.
Steve? Yeah.
Go ahead, Greg.
Yeah, thank you. Lindsay, thank you so much. It's great to see this. Lisa, great to see you, and thank you for what you've done here. I really appreciate the recommendations and the impressions as listed here. One thing I just wanted to note is that if you institute outcome measures for organizations that receive $10,000 or more, that means we could actually have over $600,000 out where we didn't request that. If we had 60 organizations asking for $9,000 or less, and I'm just wondering if that number may be a little bit high. Why can't we ask for outcomes for anything over 3 or 5? Just wanted to throw that out for conversation. I really appreciate what you've done here, and I think this is a smart thing, and I love the questions that your group is asking, your committee is asking. I did have some specific things I wanted to call up, which you've probably seen by now, and we can get to that when the time comes. Thanks.
Thank you. Yeah, thanks, Greg. And that is I think that's a great question, and it's one that we grapple with in the Citizen Grant Review Committee also, is that right now we're measuring outcomes based on if you receive $10,000 or more. And there's this question about, like, why is that a threshold? Does that make sense? Is there evidence or best practice around the number that we're asking for a threshold? And why aren't we asking all organizations? And one of the things that we're digging into with our software implementation, is there a way that we can do this so we can measure collective impact from every organization? Or does it make sense to only ask for those who are asking for $50,000 or more? We're not sure. We want to get really clear about what best practice is when measuring this kind of stuff. So thank you. Yep.
If I could tag back onto that, Lindsay, also I remember talking to, maybe it was Tom Cardamone at ACES years and years ago about Healthy Community Fund, and ACES decided that they weren't going to make an application, which was fine, but they just thought, well, the paperwork just may be too much to make it worth our while. So I don't want to discourage people, but maybe the software will enable you to actually streamline it for them and for the committee, the selection committee, so that we can collect that data and it won't make it more onerous on an applicant. Not what I'm trying to do, but certainly I think it's important, especially related to this summer and the COVID-related things that are happening, to have some oversight or accountability. Thanks.
Thank you, Greg. And I just want to, so now I can see everyone. I can see that we have our many of our Citizen Grant Review Committee members are here. I'd like to go around and introduce them before we dig into the spreadsheet and start asking some questions. So it looks like we have Lupita, who I spoke about a little bit earlier. She's our senior from Aspen High School and was absolutely critical on our team this year. She had the best questions and was so intentional and she's so smart. So we were so lucky. We were wishing she was a junior so she could give us another year. But we're also happy she gets to graduate this year. Barbara Reed, I see. There's Steve Wick. Hi, Steve. Molly Brooks. And of course, we also invite Ann Mullins because she's our City of Aspen representative, who we work very closely with on their grant program as well. And to address some of the questions that you had been asking about, Greg, we invited Angela Mills from Lift Up, as well as Lisa DeLasso, I hope I pronounced that correctly, from KJAX Radio. So we're pleased to have them to also be able to speak to any questions that the Board of County Commissioners may have. So with all of that, if there's no questions, let's actually look at the spreadsheet. Let's open it up and, oh, go ahead, George.
So, yeah, George.
No, thank you. I've got a couple of questions, Lindsay, and to begin with, on the cuts, the 20% cut for every annual application and new, were there any cuts to any of the partners, or the partners remain as they have been? with those dollars committed?
The partners all remained as they have been with the dollars committed. Their partnership, most of our partnership organizations, and this is their last year. They will all be up for reapplication next year.
Okay. And then Steve, I don't know, do you want to take this by groups? I've got some specific questions on some of the grant applicants. So how do you want to do that?
Yeah, let's go one by one through each of the goal areas.
Steve, I have a question.
And, oh, yeah.
Yeah,
So once we do that way, but
in response to you bringing up the two questions, one about the new language in the application, I don't know when you want us to address that, and the other thing about the funding for homelessness, I think that's a broader discussion for the Board of Commissioners, I'm looking at John Peacock, to have on a future agenda. That's a bigger discussion. But as far as the two questions, actually the one question would be the new language they're asking us to put into the application for next year. So I don't know when you want us to address that, Lindsay or Steve, so just don't want to forget those 2 points.
thank you, Patty. I appreciate that. The Citizen Grant Review Committee had some recommendations about language, but we'd love to hear from the Board of County Commissioners as well in terms of how to better demonstrate needs through questions.
So I'm thinking we should look through the applications and the grants first. If we have time at the end, we could go back and start talking about, I don't know if we get all the way through the suggestions that the committee made. And some of them maybe warrant a further work session, probably do warrant more discussion going forward, but we could open the discussion today. So let's look at the individual grants then in the different areas.
So we have pulled up the 2021, the mandated services that we were speaking of before. And these are the amounts that you're seeing going towards different critical services in the community. The most, I think the one where we saw the most change was just around integrated healthcare, the Mountain Family Health Centers. In the AIS, you'll see that over the past few years, that's been growing. So it's just something to note. I don't know that there's any action we need to take on it, but something to be aware of. We're seeing a pretty steady increase in our detox services with the, as well as, I think that's actually it. Core public health is pretty much staying the same, with a little bit of an increase, but not much.
So one question I would have is, with these being mandated services and some of them creeping up, they could take a higher, looks like they will take a higher and higher percentage of the total amount of money available for grants to the other organizations. That would necessarily then drive down the percentage of money that is available to the different organizations. It's kind of like a structural deficit, which we may have to address sometime in the future to figure out a different approach or different solutions. Kelly?
Just a real specific question. Looking at mental health and substance abuse, the description refers to the agency, and I don't know what that's referring to.
So, oh, can you hear me? Yeah,
Yeah.
okay. Yeah, so the agency is referring to specifically Mine Springs Health and Mountain Family Health Center. They have a, we RFP'd this business, I want to say maybe 3 years ago, where they're who are now offering the mental health and substance abuse, much of the mental health and substance abuse portion of the percentage that goes from Healthy Community Fund.
Thank you.
And it looks like Steve Wicks just said that Steve Child made a great point. He said, Steve Child just made an excellent point. Great, okay, let me open, I wanna make sure I'm looking at the same things that everybody else is. Okay, so let's just go down. Would you like me to go through each of the organizations one by one, or do you wanna just review them and ask any questions that you may have?
Well, I think we should probably each look down the list. I know that Lift Up is on this first page, and Greg had questions about Lift Up. And maybe I'll kick off the discussion. I had to do some creative math because I wasn't seeing the 20% reduction in some of the budgets. And it turns out it was that 20% from what they received last year for the organizations, not 20% of what they were asking for this year. Usually that's the same amount, 20%. The amount they got last year is the same that most of the organizations asked for this year, but in the case of Lift Up, they were actually asking for more this year. The 20% reduction came off of what they received last year, so that made the math work for me. Then I understood how you did the calculation. Let's go to Kelly and then Greg.
Thanks, Steve. On that point, I noticed further down as we go through these that there were grantees that actually had a larger than 20% reduction. So I can call those out as we get to them, but I've been curious as to if that was handled on a specific basis and why those decisions were made. And we can talk about that when we get there.
Greg?
Steve, yeah, I was just thinking, and I know I've seen this in here, and I'm just thinking about the COVID lens that naturally is applied this year, because some of these organizations really are on the front lines of dealing with our COVID response and the economic fallout after. Lift Up being one, Aspen Family Connections being another. If you wouldn't mind just articulating how the committee looked at some of those, assuming you've been making your selections throughout this entire economic uncertainty through COVID. Like for instance, looking at Aspen Family Connections, I keep thinking, wow, that I know it looks like they're requesting 40,000. We're going to cut that by 20%. It seems that they've really been on the front lines on our end of the valley with food distribution, and you know, they're really out there. So was the COVID lens applied to them, and just want to hear more about that.
It's a great conversation. I'll respond and then ask if any of the Citizen Grant Review Committee would like to also respond. So a big point of conversation during our meetings this year was with the COVID lens, and appreciating that there were some organizations that we were hearing about that were really doing a lot of the work around COVID. And so when you see in our summaries about the demonstrated need for the funding, this is where a lot of this conversation came about, was because it was hard to, you know, what we kept going back and forth on was, what are the needs in the community? What are the highest needs in the community right now? And we kept saying, like, food and, you know, here are, you know, housing. These are some really big things in our community that are happening right now. And we have this big ask with not enough funds. So how do we equitably approach that? And ultimately the decision was to cut everyone by 20%. I can does anybody in the CGRC, would any of you like to respond as well?
Yeah, Lindsay, this is Steve. I'd like to add something. There was a second COVID lens. The first COVID lens being just what you described, Greg, which is, you know, is there increased need? The second COVID lens is, how much money did this organization get from other unusual sources this year? And I can't speak specifically to Aspen Family Connections, but they would be a good example of someone who we took a hard look at their recent revenues and said, hey, even with this cut, they're going to be just fine.
Ann?
Yeah. One of the tough things was reading each of these applications, and there was so much need brought on by COVID. It was difficult not to fund everyone 100%. But I think we gave greater value to those organizations that are able to, and now I'll use this overused word, but it's really very appropriate, that were able to pivot and redirect their efforts towards something more appropriate than COVID response. Again, you can use Aspen Family Connections, doing the mental health in the schools, but now doing food distribution for the community. So that became an important factor too.
Let's see.
Molly or Barbara or Lupita, do you have anything to add as well? I just want to make sure that I honor your voices, because I know during our meetings, we all had a lot to say about this.
I'll say something. I think it was George that brought up the point about the structural deficits. I really agree with that. I mean, it's like the money that we have to recommend grants is being taken away by the mandated services. It seems like that's happened. And, you know, then you have the bigger needs of the homelessness crisis and the COVID crisis and all that's on top of everything else. So I just think that's really unique this year. Let's see, I guess this is my third year doing this now, and it just, you know, this is so different from the other two in so many ways. And, you know, I don't know how else we really could have done it this year if we hadn't have cut 20% across the board. Because, I mean, who needs it more? You know, how do you, which way do you jump with it? And how do you make that determination? And, you know, the partnership stayed the same. So nothing there changed, which was actually, you know, helped us, I think, that we could have those partnerships stay the same. So that's my 2 cents.
Barbara, and then Ann.
You know, I'll just add about Aspen Family Connections. We really took note of that. They've been outstanding in the community, and it's clear how important that is right now, that you know, really so many people are still really relying on them for a food supplement. And so it was actually pretty challenging to look at all of this through the COVID lens this year and see how much impact there has been on our valley individually and with organizations. That just was incredibly significant. Reading the mid-year reports and looking at what people were requesting. And so I think we, you know, end up as usual with this huge appreciation of this fund and what it means to the valley. I just want to add that.
Yeah, I agree with everything you guys said, and also, like, again, looking at Family Connections, like, the numbers haven't fallen significantly of the cars coming through the drive-through from, like, when the food distribution started to now, and the numbers of COVID are rising, so we're probably just going to see those numbers go up of cars coming through every week. And yeah, just COVID lens, like, how are these nonprofits allocating this money? And it was obviously hard, but we had to, like, see, like, you know, essential resources, like, versus resources that maybe aren't as essential right now.
Ann?
Yeah, I was going to make a comment about the IGAs, but Lindsay, would you like me to wait until we get to citizen review recommendations?
No, go ahead, Ann. We did that, so go ahead.
Oh, okay. Yeah, and for Aspen too, we're experiencing the same thing, that the discretionary fund is getting smaller and smaller. As the IGAs, the money allotted for them is getting larger. But having been there at the beginning of, I think the detox is the first, I very much support the IGAs as a way going forward. It allows us, the city or the county, to be very, very clear in the goals and the outcomes that we want, and also makes the agencies much more accountable than where, in this case, we're telling them what we want done. When we review other people outside the IGAs, they're telling us what they can do, and then we'll fund them. So it's a very different approach. In our recommendations, I was strongly supported looking at an IGA for the homeless shelter. But we discussed this at council budget the other day, and as Lindsay was saying, I think maybe going back and reviewing why these IGAs are in place, how they're functioning, are they successful, what are the metrics, how are we looking at them. We've actually scheduled a council work session in March because I want the rest of the council to review this whole process, and hopefully they will support it as strongly as I do. So maybe the same thing with the county. That's my comment. Oh, the other comment is congratulations, Stephen, congratulations, Greg.
One thing I had noticed, there was a 7.8% reduction in the discretionary funding available for the nonprofits. Given that a lot of them are partners and have contracts for a set amount, that left those who weren't partners getting the 20% cut. Going to next year, when the partnerships are all going to be reviewed, we probably will have the same financial, or we might have the same financial situation. We're not sure whether the COVID's still going to be having as much of an impact. It might have as much or maybe even more impact at that time. But I think next year is probably going to be harder than this year to figure out how to divvy the money up. Because everybody's going to be, there won't be anybody with a partnership that isn't continuing. Certainly a lot of them will be continued at some level of support, but I think the job next year is going to be trickier actually than the job was this year. The fallout of it this year is that some organizations that weren't partners took a bigger cut where others didn't get any cut. So looking at next year, trying to figure out what's the priorities, make sure that each of the organizations, that their mission is really in tune with what we want to accomplish with the Healthy Community Fund. And so I think next year's job is actually going to be harder than this year's doing that process.
Thank you, Steve. We are really lucky to have an incredibly engaged Citizen Grant Review Committee who have, for the most part, agreed to helping us think through how we better demonstrate needs to make scoring, to make it, not to make it easier, because it's never easy, but to give clarity to the process in terms of what the need is for each of these organizations. We've already started looking at some of the financial information, how we can get that into our software in a way that really helps the CGRC make these decisions, as well as looking at how we're scoring outcomes, and because the outcomes and the goals and outcomes are really tied to their contracts. So how can we be managing this through their contracts to ensure that the funding that they're getting is really, contributing to the way that the Healthy Community Fund is intended to do. So we're looking closely at it and are open to all feedback and anything that the board would like to see as well. We invite that.
Greg?
Yeah, thanks, Steve. Well, Lindsay, while you're on the topic, one of the things that I've been concerned about lately is just when we have a disruption, as we've seen, that's caused an economic crisis. And in our community, we're so grateful to have had a huge financial response from philanthropies, the Community Foundation, and everyone who stepped up and dumped a lot of money in to try to keep things going and prop up these essential organizations to keep the most vulnerable people going. And I know Sundin had a big hand in that. One of the concerns I'd have, one of the questions I would ask your committee to contemplate for next year at least, would be this idea of certainly the financial oversight with financial review committees, things like that. It seems to me that any organization here would have a financial advisory board, somebody who can go through and look at what they're doing. In addition, also just to talk about things like mission creep. You get a lot of money and you decide to start doing different things with it. Perhaps mission creep is pretty common. Sometimes the necessity for a certain need that goes away, but you've got the organization in place and you look for something else to do with the money. That's not uncommon, but I think it's something to be aware of as the relationships mature. And I don't have any specific things I want to bring up, but I just think it's an important thing for your committee to be looking at. And maybe that can be built into the application process or the review from the previous years.
Great, thanks, Greg. I will add that to our notes for discussion. Appreciate that.
So,
Okay.
Greg, you had brought up the question of lift up, questioning how it's working in Aspen. I think across the board, looking at lift up across the board is being very successful, perhaps less successful in the Aspen location. Do you want to talk about your concerns?
Steve, I think the concerns were just generated from some of the calls at our Nan, you'll have to remind me the name of what the meetings were called this summer, the telephone calls we have on Fridays. I'm blanking. It's not SANA, it's the food security or something like that.
Yeah, it's just the Pickens County Emergency Support Function 6 Food Distribution Group.
Right, and the gist I got from that was that I think we all were feeling a little bit like maybe we're the last ones on Lift Up's list for establishing the program up here, and I know there was some frustration. And I'd prefer to hear Nan articulate it if you'd be willing, but what I took away is that this was a monumental task that Lift Up had to take on this year. I think Angela can confirm. I think were they up 600% or 800% in their demand for services for food relief and the weekly food packages. So I know it must have been an overwhelming task, and I really appreciate that. That accompanied with, a lot of money flowing in and how to allocate that. I'm sure they were understaffed and overworked all summer, and so I want to acknowledge that from the beginning. But I think that's where my concern came about, just wanting to make sure that we are all still on the same page and the deliverables in the way of reporting and financials and reports on what actually happened and what went down after a crazy disruptive summer are available, because I think that's going to be important going forward. So that was the question that Lift Up.
Okay.
So I'm going to let Angela answer that. I'm Nan Sundin, Human Services Director. I think what you're talking about, Greg, that I've shared with the board and with Angela and everyone is for years, even before COVID, we were working to build Lift Up's capacity and to get a consistent presence here. And so we have not wavered from that request, and Angela and her team have stepped up with a plan. We're all hopeful that this can work, and I'll let Angela discuss it. And yeah, we have had kind of underrepresentation of Lift Up here for years. Even during COVID, Food Bank really was our bigger partner up here. But I believe that Lift Up sees the need, has a desire, and wants to step up to the plate in Aspen. And so we're excited to support Angela in doing that. Angela, do you want to add to that?
Yes, thank you so much. Thank you, Nan. Thank you, Greg. Thank you, everyone, first for giving me the opportunity to come and talk to you today and get some of these questions answered. This is wonderful for me to be here. Nan is absolutely right. So when I joined Lift Up just over 2 years ago as the executive director, we almost started talking immediately about the lack of resources that Lift Up was able to put into Pitkin County at our Aspen facility in particular. So even pre-COVID, we were working on plans to stabilize Lift Up's food distribution program in the area and then in Pitkin County as a whole. What we've been able to do, what we've been able to do with this partnership is open Aspen Pantry. As you know, the Aspen physical pantry was shut down, as were all of the rest of our brick and mortar locations with the onset of COVID. And we converted to the mobile distribution. In order for us to keep up with demand, as you said, Greg, it was anywhere between 600 and even 1,000% increase, depending on which community we were serving when COVID came to join our team. So we closed all the brick and mortar, converted to mobile. What we've been able to do is reopen Aspen. Last week, Aspen brick and mortar location did reopen. We are functioning appointment only. We are doing curbside pickup. One of the things that's really exciting is with this, we're able to have via phone and email even deeper conversations with our clients to ensure that if they have dietary issues or needs, that we're fulfilling, kind of getting back into that pantry of choice option. So it's not what we've been doing is the pre-packed food bags to everybody getting the same thing, and we had to step away from the pantry of choice. So this pilot program in Aspen is enabling us to get back to the pantry of choice, ensuring that people are getting the food that they need when they need it. You are spot on. All the accolades for Aspen Family Connection, and Catherine kept us going. So we were able to focus on Lower Valley, and Food Bank of the Rockies and Aspen Family Connection stepped up and ensured that Aspen was being helped just because we did not have that existing infrastructure to take care of our whole great big footprint. So now we have, for the first time ever, Lift Up has a dedicated paid staff person to specifically concentrate on Aspen and Pitkin County. Her name is Julia Farwell. She worked with City of Aspen. She worked with Carbondale. She is a sustainability graduate from CMC, has been in the area since the 90s, is bilingual. So she is really, for the first time ever, a paid Lift Up person to concentrate on Aspen and Pitkin County, which is very exciting. Julia is bilingual. Our Aspen Pantry is open more hours than it's ever been open before. It's now open Tuesday through Friday from 11 a.m. until 5:30 p.m. and Saturdays from noon until 5:30. So again, really exciting to have steady hours of access for folks. Even before, when Aspen was open, it was 3 hours a day, a couple of days a week. So really, as Nan said, finally being able to get to where Lift Up knew that we needed to be. At that location, we are able to hand out fresh food, which consists of locally purchased produce and meat. I'm excited. I'm putting another order in with Dean today. Greg, thank you for that connection. She said that she just processed 10 cows, and I think that we're going to end up purchasing hopefully all all 10 cows and getting that meat up to the Aspen pantry. Shelf-stable items, and then something that we've always done is the bus passes. So we'll be able to bring that back so people can access Lift Up for food, and then bus passes if they need to get to work, a doctor appointment, or something like that. Also being mindful of that mission creep, because you're right, it's such an easy thing to do when you see a need and you just want to fulfill it, but really staying core to food insecurity and helping folks have that access to food. Another thing that we've been able to do, this partnership and focusing on building infrastructure, is adding our volunteer manager. Lift Up hasn't had a volunteer manager before, and an organization that really relies on volunteer time to not have that was a bit wild. So we have Sophia Geeling, and she is bilingual as well. She, since joining the team in late August, was able to provide civil rights training to all of our volunteers, all of our staff, and all of our board members. We're working on equity and diversity training for everyone as well, and getting sexual harassment training too, just because it's something that we feel needs to be top of mind. So able to add a lot of training for the staff board and volunteers. And I really appreciate that Nan was able to, very early in my tenure, acknowledge with me the inheriting of a broken system. Honestly, the food distribution system needs a lot of attention, and that we were able to do that and put together strategic timelines, and now reopen Aspen with a paid staff, with these extended hours. COVID really gave Lift Up a big shove in the back, I think, of do these things and get them done quickly. So in that way, COVID was a blessing, and Farm to Food Pantry grew, and we're able to provide fresh produce and that local meat that I had talked about. So there's a lot of things happening, and that the conversations like this are so key, and it's nice to hear talking about goals along with the funding, because that makes it easy for me as an executive director to have that up front in the beginning. Okay, this is the agreement, here comes the money, this is what we need to do, and then with the leadership team, we're addressing it on a weekly basis. Are we doing this? Are we doing this? Have we reached the goal? I would also encourage the board to have these conversations with your nonprofit executive directors at least annually, if not biannually. Invite a handful of us at a time to come and just have this conversation so you can see what's going on real time. And I apologize, Greg, Nan, I think that was a short question that I talked a lot about, but if there's anything else, let me know.
If I could, thanks, Angela. I really appreciate that. And yes, just to reiterate, I know that the lift was really heavy for you all this summer, and you guys have pulled it off, not without difficulties. But the other two things I just wanted to follow up on. One are just wanted to understand the financial oversight that Lift Up has, and also the makeup of your board of directors. How involved are they? And it occurs to me, I'm not sure if we even have a member from this end of the valley on the Lift Up board, and if that might be something that we should be advocating for.
Yes, thank you. So financial overview is done by our board. We have, again, in my tenure, established a finance committee that I meet with twice a month, and then report on finances to the board as a whole on a monthly basis. So that's been really nice, and something that, quite frankly, didn't exist at that level before. Representation from your area, I do have 2 board members that live in Aspen that are on the board. However, we have identified that we need a more active board, and in active, I mean showing up at distributions, showing up at fundraisers, showing up at food bag packing. Just, it would be really amazing to have board members that have the time to be the kind of board members that lift up needs now in the establishment that we're growing into. We have had a change on the board, so in kind of asking for this is where the organization is going, this is what the board should look like. Our board president has stepped down, and so we are able to onboard a new board president and onboard some new board members through the partnership that we have with Aspen Community Foundation. We will be working with a consultant to help us rebuild our board to reflect the diversity of our communities that we help, and also to recruit some of those gaps that we've identified. At our last board meeting, we had 2 new applicants, which is really nice. One from the SANA committee, who is bilingual, and one actually from Pitkin County staffer that I think would just be an incredible asset. So it's good to see those changes coming with the board as well. And yes, Greg, if you know anyone that has a passion for the food insecurity and wants to join and help move this in the right direction, and will come out and really get in it with me and help say, hey, Ange, you know, we need to improve here or here, and let's deal with this stuff and move forward so Lift Up can remain the anchor institution to tackle these issues.
Great, thanks, Angela. I really appreciate that. And you know, I actually mentioned it to Marky Butler, who's ending her term as Snowmass as mayor, and she'll have a lot of free time. And her eyebrows went up when she heard that maybe you might need help. So I'll put you in touch with Marky. Finally, there was one last thing. I just wanted to give a plug for the Farm to Food. If you could talk a little bit about the Farm to Food Pantry program. You mentioned local beef being used from local ranches and other local produce. A little bit on that would be great. Maybe just a brief report. I don't know how it ties into what your ask is here, so I don't want to take too much time. But that was something that I thought was very important because it kept money circulating in your local economy.
It did, yes. Thank you, Greg. Thank you for the opportunity to talk about Farm to Food Pantry. The program existed prior to COVID, but was very kind of shoestring. And then with some help, we've been able to take Farm to Food Pantry to the next level. What Farm to Food Pantry does is it buys on the front end from farmers, ranchers, and producers in our community. So they have the operating capital to invest into their farms and ranches. For example, one of the farms, Highwater, in our community, we ended up through the program buying 80% of their farm product this year. She said that this program, thank you, Greg, helped keep her farm afloat. And so what we're doing now is signing the contract for 2021. In December, I will be giving money upwards of probably $120,000 invested in local farmers and ranchers that they will get at the end of this year, that they can buy their seed, that they can buy their seed, and they know that they have that guaranteed buyer on the tail end. So that's the beauty of this program. Also, we have the flexibility. I want to ensure that our clients are getting local nutrient-dense product. If we say, hey, I'd really love X amount of zucchini, and then the zucchini crop kind of takes a dump, but the peppers crop is amazing, we can adjust and buy that way. So the importance is our clients are getting the really wonderful food, our farmers have the operating capital to sustain their farms and create jobs. The next iteration of this program would be, right now we've got farm to food pantry, then we would go food pantry to farm employee. And so working with the farmers as they grow their businesses and need to onboard folks, we can connect our clients that have agricultural backgrounds or are looking to go into that industry to become staff on these working farms.
Okay, Angela,
Great.
thank you very much. We need to move on. We have quite a ways to go still looking at other organizations. We appreciate this deep dive into looking in our into our local food security, which affects more than just Lift Up. It's, you know, a pretty broad spectrum across our community. And I feel really good knowing more now about the changes you've made at Lift Up. So we have to move on now, but thank you, Angela, for your input today. So
Thank you all for your time.
okay, going back to Lindsay and I think we should probably move through these different pages and see if there's any other concerns that commissioners have on any of the organizations.
Yeah, I want to make sure that we address, so Kelly had asked about some organizations getting less than the 20%. And also there were some questions around KJAC as well. And we have Lisa Delato here from KJAC to answer any questions regarding that.
So Kelly, do you have a specific, I mean, I noticed that the one that I noticed was way less was the homeless shelter. Because they had asked for the pie in the sky and got 20% less than they got last year is what they ended up getting. I think that's a unique situation that we need to look at as a board, because the demands are so huge for the homeless shelter going into this winter especially, with a whole different program. George?
Well, I don't know if Kelly needs to respond. I have a separate question, so.
So Kelly, do you have anything you want to bring up right now on that?
I'm going to give it a second look because I'm realizing my math at 11 o'clock last night may not have been very good. So I'll let George go and then I'll weigh in.
All right, thanks. I had a question on, you know, we've talked about because we're having to cut these organizations, and are there other opportunities that these organizations should be looking at in terms of going out to other entities? And so, for example, Community Health Services, which we used to be the primary sponsor of for a substantial amount of dollars, and when we created our public health department, of course, we shifted those dollars to our public health department. But Community Health Services continues to provide great community services, and I'm just curious if we look at them as a model, how they're able to be able to bridge the gap the last several years. I don't know, Nan, if you have some insight on that.
You know, I'll let Lindsay mostly answer that, but Karen Kenneman in Public Health are working with Community Health Services and worked with them to find efficiencies, and they've been finding other revenues, so I think that's the short is. George?
Yeah, thanks. I just think that may be a model for other organizations that continue to rely so much on this grant process.
Right. Yeah. Because they've taken, you know, we have reduced their allocation, and they're thriving as an organization. So
right.
Exactly right.
Kelly?
Sorry, I'll just note that my math was really bad. I was looking at the 20% reduction what we fund from this year, what is being proposed to fund from last year, what was funded. I guess the only one I noticed is that Lead with Love is the only one that falls below that, but their score looks pretty low as well. So thanks.
Yeah, I went through the same math exercise myself until I realized they were consistent across the board, comparing the community nonprofits who weren't partners all did get the 20% reduction from what they got last year. And that, I didn't see any inconsistency there. They didn't get 20% from what they asked this year necessarily, because some of them asked for a lot more this year and they didn't get they didn't get that. It just calls out that there are needs in our community that really aren't being met at this time. We don't have our wherewithal in the Healthy Community Fund to fund everything that we would like to. So that's, you know, all of you on the committee, I think, did a good job. Like, you kind of had to bite the bullet and make a tough decision there, but you did what you had to do to get the more or less balanced budget.
Steve, I have a question.
Patty?
Yeah, I have a question. I'm just gonna jump right to it. It's one of the new requests from the Aspen Historical Society. Do we have any other requestees in here that have their own tax-based funding? There is a tax district for the Aspen Historical Society, I believe. Ann Mullins will know the answer to that.
Yeah, do you know that, Ann? You're muted, Ann.
Sorry, guys. No, Patty's correct. They do have a separate tax district, but and City of Aspen continues to give them grant money, and as has been explained to me, the money coming from the tax is very restricted. In fact, I think it might be just primarily capital projects, bricks and mortar. And the money they request from Aspen and from the community fund is to support programming, which is not supported by the tax. And the programming depends on the grants and donations.
Okay, thank you, Ann, because it was just concerning. I don't think it's our norm to help fund from the community fund entities that have a tax-based source of revenue. Their request is minimal. I think this year it might be a big request, a big need for support that they're asking for. So I think we need to be cautious in the future and have maybe some kind of policy discussion. There's a lot of things I think this next year we need to bring back to the Board of Commissioners in a work session to discuss the language, the funding needs, and who we're going to prioritize. So this might also be a question to be asked as part of our future discussions. But thank you, Ann, for your information.
George?
Thanks. That's nice to know that our Citizen Grant Review Committee reflects some of the same questions that the BOCC is. I saw a few people smirk when you asked that question because it came up in our conversations as well, so thank you.
George?
Yeah, the Aspen Historical Society has come before the committee in the past with a grant application, and in the past we've not funded it basically because they are a funded district on their own. So I still would have a question on that. And then my other question I have is with the other new one is the Aspen Chapel, and I just wonder if there's a redundancy there with other organizations who are already filling a need in terms of children and young adult programming.
I think Lindsay's consulting with someone there.
Thank you. I was just reviewing I was trying to find it on the spreadsheet. I can look at it.
Lindsay, do you mind? This is Steve. Do you mind if I pipe up?
Yep, go ahead.
In terms of the Aspen Historical Society, I had the exact same question as Patty. So we hit the pause button on them and realized that this was for something they probably couldn't fund from tax dollars and being minimal. We thought it was reasonable, but we did consider that. Your question about redundancy of the program at the Aspen Chapel is also a good one, and brings me to a theme we often discuss at our meetings. We have what I call a messy vitality with our local nonprofits, and as much as I'm all about, collaboration and impact-driven philanthropy, there's something to be said for these small nonprofits who each have sort of found their own niche. They've each found their own board of directors. They've each found their unique way of fundraising. So yes, there probably is some redundancy with the Aspen Chapel, but I actually think that's a good thing.
Yeah, I can add a bit as well. So the application for the Aspen Chapel was both asking for funding around support for youth and young adult programming, but for parent support in the holiday gift baskets program. So there were some specific requests in terms that we didn't see redundancy in other applications for part of that request. But I think it also speaks to the bigger question, again, around need and how we're scoring and looking at that. So it's something we really need to drill into for this next year.
Patty?
Yeah, I want to correct the statement I made. I was thinking of the Aspen Chapel, looking at the Christmas basket program, when I was talking about the Historical Society, because I didn't have the language in front of me. The Historical Society is just for educational programming, and I kind of find that difficult to think that wasn't part of their tax question. So maybe we could look into that. But Steve, your point about redundancy for those needs right now, I think, is important to note, and I'm supportive of that. And I'm supportive of the Christmas basket program for the Aspen Chapel. It brings back into question the support for educational programming for the Historic Society in light of their being tax funded. So not having the language of the ballot question and the restrictions in front of me, it's difficult for me to have a clear answer on the question of funding them or not. But we could get that language.
Let's see, could we address the question of Aspen Public Radio right now, which is a partner with $9,000 per year funding? And this is the last year of that, is that correct, Lindsay? Lisa? Yeah. So Greg, you were the one who brought up this question. Why don't you address your concerns?
Sure, and I really appreciate the ability to bring this forward. I know last year, I'm going to look at my notes, KJAX made some major changes to their programming in the past year, even pre-pandemic, which I think we can easily say were disturbing and controversial through the community. And these changes included basically canning all the volunteer programmers and DJs that they'd had. Some had gone back since the inception, maybe 35 years. And I know a lot of people in the community have been pretty upset about that. And the local programming was replaced with programming that's really accessible in many other places. Programs that are repeated, several times and are coming from national sources where you could go online and get fresh air or any of these other things. So I'd love to learn more about what and how the value of KJAX services locally, unique services, have changed, and perhaps why we should still continue supporting them to the extent we are. And I'm guessing your committee has gone over this. I guess I'd like to have some details because it never really had a satisfying answer. I was an advisory board member to KJAX many, many years ago, and I've always had a great interest in them since their inception in the mid-'80s. And so I really like a robust, strong local presence. And our community is really held up for and appreciated for the number of great local news outlets that we have here. Most communities in the country don't have even one newspaper, let alone two papers and several magazines and the radio stations. So, and I have to say, I think a lot of people, including most DJs, or many of them, just moved on and went down to KDNK in Carbondale. And I know we fund KDNK. I was going to propose that perhaps we just fund them with equal amounts, because I think some of the, I think KDNK is actually carrying some of the weight with local news now, and certainly with programming, volunteer programming for the community. So I was going to propose that, but I don't want to interfere with how the committee's worked, but I'd certainly like an explanation and maybe to learn more about, what can we expect from KJAX going forward, and to know that I want to make sure all these groups applying to us understand that this isn't an annual given, that we're going to fund them every year the same amount. and I guess we need some accountability. So that's what I'm looking for from KJAX's board and perhaps their staff who can help us if the staff has been around long enough to know what I'm talking about. Thank you.
George?
Yeah, I agree strongly with Greg. I raised that question last year as well. And coincidentally, Greg, I was the one that boosted KJAX's donation several years back to equal KDNK at the time. But I think it's probably more fitting that now KJAX goes back down to equaling what KDNK is getting. I am concerned that we lost a tremendous amount of community radio through KJAX with the new programming, and I think that was not a great decision by the board. So I would support equaling it back down to what the KDNK is getting.
Kelly?
Your partner.
Thanks. This raises a question for me about how does the Healthy Community Fund deal with partnerships when there is a significant programming change? Because that's what we've seen over the last 3 years, is entering into this partnership, and yet in the midst of that, we are retaining true to our obligations, but their mission has changed in a pretty significant way. So I think that's a question probably for Lindsay.
Yeah, thanks, Kelly. So we have Lisa DeLasso on the call. I want to make sure I answer Kelly's question. So I'll start with that, and then I'll let Lisa respond to some of the other questions that the other commissioners had. So the Citizen Grant Review Committee does review the partnership year to year. There's not as deep of a dive as we do on the annual. And I'm actually surprised the Citizen Grant Review Committee for this particular one, and I'll let them also speak to this. This didn't come up for us this year. So surprisingly, I hadn't heard much about this until now, so I can't speak too much, but I think I'm going to echo kind of the theme of the Healthy Community Fund's presentation this year, which is how we demonstrate need, especially when there's things like this, programming changes, whether it changes for the for the better or for not, or however it's looking, but how do we kind of narrow that mission creep if it's happening, or make sure that we're scoring based on the ballot language and the need for the money, versus kind of a quick, like what we had done this year was a quick overview of our partners. So we went down each of them, made sure that there was no red flags that came up for them, and agreed to move forward to the next organization. So definitely a need there, Kelly. Thank you. Lisa, do you want to respond to some of the questions? Yeah, thanks.
Sure. Well, yes, so my name is Lisa DeLasso. I'm with Aspen Public Radio. I've been there for the past year and a half. I'm the Development and Community Engagement Manager. So I just want to say thank you to everyone for the opportunity to clarify any questions, as well as for the funding consideration, both this year as well as in the past as a partner. I'm a little disturbed, frankly, by the idea that we are no longer fulfilling our mission. I don't think that that's an accurate viewpoint. Our mission is to support, nourish, and enrich our community with informative and educational and entertaining radio programming, which we are still doing. We are still deeply invested in our community, and we are still engaging in a lot of local reporting. Aspen Public Radio was the first news outlet to break the story about COVID-19 being confirmed in Pickens County in March of 2020. So we actually still have quite a robust local news programming. We will be embarking upon a mental health series later this year as well. We do have some additional focus on, I think, addressing the concerns about running syndicated programming that would be accessible perhaps through streaming online. We've actually seen exponential increases in streaming for our station this year for nearly 18,000 listeners. And, to be candid, the negative feedback that we have gotten at our board meeting, which was approximately 40 people who attended that in January, February, after the programming changes were announced pre-COVID, as well as any negative feedback that we have diligently tracked in the newspapers through letters to the editor, still represents less than 1% of our listener base. So I do just want to reiterate, we are absolutely committed to the community, and I think that that's been evident through a number of partnerships we have embarked upon this year, including with Aspen Homeless Shelter, providing socks to Aspen Homeless Shelter, which is a highly requested item amongst homeless shelters. We've also partnered with Lift Up and Food Bank of the Rockies to provide 100 emergency bags of food to Lift Up, as well as 4,000 meals to Food Bank of the Rockies. We continue to partner with Aspen Historical Society on our local programming quarantine stories to capture the stories of what has happened during this pandemic through multiple viewpoints. So I think overall, the idea that we are not here to serve our community is, inaccurate. And, I will say, based on the hard work that our staff has put in over these past, several months, they have greatly expanded their news output to be able to serve our community and to make sure that people are informed with wildfire coverage, election updates, and fact-based news.
Steve, I have a question.
I'll just also add, our board meetings are always open to the public. We do have one coming up in December. Since that board meeting in February, we have not had any members, from that initial group attend to continue to voice any concerns. Our executive director is also happy to talk to anybody at any time. Our email addresses are all on our website. People are absolutely welcome to reach out to us to express their concerns. We've just had a community advisory committee meeting this morning that was open to the public as well.
Patty?
Yeah, this is back to the question of partnerships. Have we ever in the past reduced the amount that we're giving to a partner within their, a 3-year time frame? I think this might be a first.
Lisa, Lisa Yorker, do you wanna speak to that?
We have taken down the amounts, and we've also required more reporting from people who've been partners before. It's unusual, but it's not without precedent.
Okay, thank you. I just couldn't remember any we've done, because it seems like we do this so there's surety on both sides, how much we're gonna be giving out and how much they're going to be getting, so that they can plan around that for a 3-year time frame rather than wondering year to year. I understand Greg and George's concerns, but I'm supportive of giving Aspen Public Radio this amount, and then having a serious discussion next year when they come back to renew their partnership.
If I would do anything, I would increase the amount for KDINK back to what they got last year, 9,000, which would be equal to what Aspen Public Radio is getting. I think one reason, Lisa, that people quit coming to the board meetings was they are now listening to KDINK, because KDINK has that messy vitality that all the DJs used to have on KJAX. And people are now, we listen to Dan Sadowski now on KDINK. He used to be on KJAX. And that's perhaps why some people in a sense, they gave up on getting that messy vitality back at KJAX right now, and they're just listening to another station. So do you want to respond to that, Lisa?
Sure, I'm happy to respond to that. We just don't have any evidence that we have lost a massive amount of listenership based on our programming changes. I know that might be a little hard to believe, particularly if you're, a big fan of some of the jazz programming that you noted, or some of the classical music programming that we also shifted around. But it's true, we just don't have any evidence to support that we've lost listeners. In general, terrestrial radio that you would listen to in your car, for example, has seen some numbers decrease this year across the board because of COVID. People were not commuting, for example, to work. But we have seen, for example, in March, our streaming figures and our online figures exploded over 200%. So we just don't have the evidence to support the idea that folks are heading over to KDNK instead. And I do just want to say, we absolutely support the work that our friends at KDNK are doing. When we made the transition away from the jazz programming, our executive director, Tammy Turwelp, actually spoke with their then executive director, Gavin, over at KDNK to, talk about ways that there might be some opportunities available for those volunteer DJs. And my understanding is that those volunteer DJs, some of them have made their way over there. We are happy for them. We think that that is a great place for them to be. It is a wonderful community radio station. The feedback that we have gotten from many of our listeners is that they would turn off the radio when music came on. So we were really pushing and pulling against our, two audiences, so to speak, and not really serving the public in a way that would be effective to our mission. And that was why those programming changes were instituted. I will say volunteerism is not out of our, aspirations at all. It's just a matter of COVID. We have a number of membership drives that we have had volunteers assist with in the past, and they've been fantastic. I know because I've worked alongside of them, but we just can't do that this year because everybody's working from home and trying to socially distance, and we're in a city-owned building. So having a volunteer program this year has just not been something that we've been able to, participate in from that standpoint.
Okay, board, where do you want to go on this? I personally would increase KDINKs up to 9,000 and have that be the lone exception to the 20% reduction. Greg?
Thanks, Steve. I support your suggestion. I did want to say one last thing that I did not mention earlier, just regarding the, and maybe since Lisa's doing development, maybe we don't have time to get into it, but I do notice it seems as if the solicitations and promotions of fundraisers is ongoing. It's almost a year-round thing now, at KJAX in particular, I can say, where they'll have a fund drive and it might only be 2 weeks long, but they're promoting it pretty intensely for at least 2 weeks before and then 2 weeks after. And it just seems like there's a constant, continuous solicitation. And so I'm assuming our advisory board saw the financials and understands where KJAX is going with financial health and how they're conducting, how are they doing? Do they really need us is the next question. And my guess is yes, I'll go along with your recommendations, but I just wanted to call that up and make a note of it. It just seems like the fundraisers are continuous. Maybe that reflects a need for money, or maybe it just reflects a desire to grow bigger. I don't know. I'm not entirely satisfied, but I'll go along with Steve's selection.
George?
Yeah, I disagree, because that's really a bad precedent we're setting. The Citizen Grant Committee had to make some really hard choices. And the choices they made, given the dollars that was available, was to reduce all the annual organizations by 20%. So all of a sudden, we're picking out one organization that's an annual and to bump them up, versus the issue is the money that has been given to KJAC, again, I was the one that supported originally several years ago to raise KJAC to equal KDNK, and now I'm sort of biting my tongue on that because I disagree with the comments made in terms of the community response. You know, I don't go to the board meetings, I don't write letters to the editor, but I certainly vote with my wallet. And where I was a poster child for KJAC for many, many years, we're not contributing anymore. And so I would reduce KJACs to KDNK versus the other way around. There's not a lot of money, but it's more in terms of a principle and addressing all the other organizations that have had to take the 20% cut.
So, can I just second George's side? Someone else. Yeah, I just want to second what George said. I totally agree. If we're going to cut all of these other nonprofits by 20%, why are we going to make an exception for one? And also, I just, from my viewpoint, I don't think it's an essential service. I think we have bigger issues to focus on. I think it's a very important nonprofit, but I just don't think we should make an exception for one.
And Steve Wicks also pointed out the fact that KDNK is actually located in a neighboring county. It's not even in Pitkin County. I don't want to reduce a contract of somebody. We have a contract with Aspen Public Radio, and I'm not going to go anywhere near reducing anyone's contract. That's our obligation. I'll withdraw my suggestion for reducing the funding for just one of the organization. I mean, increasing the funding for one of the organizations. That would not be fair to all the others who are taking the 20% cut. And this will merit further discussion next year. So we're almost out of time. We really need to be wrapping up the whole rest of the discussion.
But we need to have a decision on this before we move forward.
A decision on now.
I'm for just leaving it as it is, and then opening the discussion next year when we review their partnership.
I just want to make sure we capture what this, we have some Citizen Grant Review Committee members posting in the chat, and I just want to make sure we capture what they're saying in the discussion. So Molly Brooks said, just because the programming is new and different doesn't mean it's bad. That seems to be the implication. Personally, I listen every day. My daughter did a Gen Z radio show last year. I think the audience is younger now. Be careful, you guys might age yourself. If the internet goes out and cell services go down, then you always have local radio for public and important information. I believe it serves a very, valuable service and makes a big impact to a certain field. And he says, let's not void one contract. We'll take a hard look next year.
I'll just make one comment. I think it's also just in this discussion, it'll be good for KJAX to look, at the comments that are made about KDNK, because I think it's really important community radio, and you can learn something from your neighboring community. KDNK's communication goes out valley-wide, and I think we all appreciate that up here too. So, I think that's part of what we're discussing, what makes a healthy community, and clearly the radio stations are important. So I think we can all just consider what all these comments have been today, and we will absolutely be discussing this next year.
Thank you. And Lupita has one last comment. She says, Molly, I totally see where you're coming from, speaking from a youth member. When I get into a car with my friends, we don't listen to the radio ever. We turn on Bluetooth or auxiliary.
pretty good. So Steve,
Okay, Patty,
yeah, outside of that question, I'd like to know where the board stands on the Aspen Historical Society new request. And those are for me, the outlying questions, and we are at our time limit, and we do have a very long day. And I'm not sure if there are other issues we need to address, but that's another question I have before I can move on. Is the board comfortable in supporting the Historical Society request?
George?
Patty, I would follow up your suggestion, look at that ballot initiative, because you could be opening up a whole new avenue here for other organizations to tap into the Healthy Community Fund if they're already getting dedicated mill levies.
So if we could see a copy of the ballot language between now and next budget or approval, I think that would be great. Thank you, George.
Yeah. Yeah, that is, it's a precedent, potentially a precedent-setting thing, which I think we
Yeah.
need to be careful and take a look at it before we do that.
Yeah, or it might be fine. We just
Yeah.
don't know that yet.
Yeah. Greg?
Just very briefly, if somebody could explain to me why having a partnership agreement would preclude us from making any changes to the amount granted up or down.
Does the Citizen Grant Committee want to speak to that at all? I saw Steve kind of smirk a little bit.
Smirk?
Yeah.
It's not a smirk, it's a reminder of how we went there during our committee meetings, and it's a very good question, because you could argue both sides. And I think the reason I fell on the side, finally, of honoring our contracts is because I believe a promise is a promise. We did sign a contract with these organizations. They're anticipating this funding. They're counting on it. They probably have it put to use. And yes, it's probably unfair to the folks who are not annual contracts. But as I've told my kids repeatedly, life is not fair.
And up for broader discussion this next year.
Yeah, definitely. We did bring up some issues today. We don't have time, we're out of time now. We don't have time to take up the other suggestions that were brought forward by the committee. So I suggest we have a work session sometime and actually get Lisa and Lindsay back and all the board members from the Healthy Community Fund Grant Review Committee, and we could have a further discussion about some of the broader questions that you brought forward to us. So, I think you guys had a hard job this year. I think you did a good job bringing, a presentable budget to us that is a realistic one. So we will look at this when we do our final general fund. Is it in the general fund or?
No, it's its own fund. So today would be your recommendation
This
to
is the
move forward with the
recommendation?
budget, yes.
But we do want to take a look at that one issue regarding the
Yeah, so what should we do with that?
Historical Society. Other than that, I think we're all good with the budget the way it is,
Okay.
with that possible one
wonder-
exception.
Sorry, Steve, I wonder if you all could make a recommendation to approve pending a review of the ballot issue, which you could change. You can change it before you approve it, but that would probably help move the request forward. And then I would also just suggest that Lindsay look at coming back in January after the budget when there's time to think about these other issues that Citizen Grant Review Committee brought up.
I can't commit to January, but after the first of the year. But
Steve Wicks had another comment too, Steve.
So is everybody good? A thumbs up with that suggestion? I'm good with how Nan worded that we're approving it pending further review of the one. So is everybody good with that?
I'm good with that. Thank you, Nan, that's a great suggestion.
Yeah. Okay, thank you all
Did
for
Steve-
being here today. It was a
Did-
great discussion.
Did Steve Wicks have another comment?
Who did?
Yes, I know we're running short on time, but I can't resist just shining a little sunshine on this meeting, which is ironic. My committee members know that I'm the grump on the committee and usually not so sunny. But I just want to finish with two observations. First observation is we were faced with bad news and good news this year. The bad news was that we had to give every nonprofit without a continuing contract 20% haircut. That was difficult. The good news, and I can't close this meeting without pointing this out, our area nonprofits, with a few exceptions, have a lot of cash in the bank. They have $200,000, $300,000, $900,000. My theory on this is that last year's fundraising, they have that money in the bank, they have their grant receipts in the bank, but they were actually executing fewer programs and having fewer expenses in the spring and the summer. So just know that despite the fact that our local nonprofits got a 20% haircut, my feedback to you is they're in generally very good shape financially. And the second thing that I can't let this meeting close without mentioning is I've been, like all of us, been thinking about community and what makes a community. And if each of you commissioners had done what we did on the committee, which is to read 50+ grant proposals, you would be struck by how many locals volunteer on committees, how many people volunteer, how many people attend these fundraisers. I hate to admit it, I'm actually kind of missing the fundraisers. It's where I see my friends. So just in closing, yes, let's not eat further into the discretionary money we have for our local nonprofits, because I believe the activities they bring to our community are a really important part of our community fabric. Thank you for allowing me to say that.
Thank you.
Thank you. Amen, I might say to that, Steve. Thank you for those comments. So, I think we'll end the discussion right now. It is time for our lunch break. So, we'll be back at 1 o'clock, grassroots, and we'll take a lunch break now of not quite an hour. So, thank you all for being here.
Thanks, guys. Thank you. Good to see you.
Thank you.
Welcome back, everybody, to our Tuesday, November 10th work session. It's the afternoon part of it now, and first up, we are going to do a review of future agendas.
Yeah, thanks, Steve. Just have one item for the board's consideration. Of course, this evening you'll be hearing public comment on the proposed changes that you all have made to the ASE vision document. We expect that that's really going to take pretty much all of the time that's been scheduled. We do have a light meeting next Wednesday. We're guessing that that meeting will take about 90 minutes. And so we wanted to propose a follow-up work session again for the board for all of you to consider the public comments and have time to discuss any changes that you would like to make and give staff direction on a document for final adoption. So that would, we'd probably take a break after the 90 minutes. So either start at 1:45 or 2 o'clock to do a work session. I think our preference has been to schedule a little bit longer time, and then if you don't need it, we won't use it. So I'd say a minimum of 2 hours for you, 3 hours, you think? I guess I'd take guidance from the board as far as how long you'd like us to schedule.
1 hour.
1 hour. All right, I got you to 2, I think we should schedule it till 5 o'clock. Oh, I'm on. Till 5 o'clock.
Yeah, I think I would put an end time to it. And I would say at least 2 hours. But if it's 90 minutes, that'd be 1:30. 2 hours would be 3:30. Well, 3:45 if we take a break. I would say at least 2 hours personally.
I'd like to get her done.
But this might be our best opportunity to wrap up all of our discussion on it too. So what does everybody feel? How do you feel next Wednesday afternoon?
I think it's fine to schedule 2 hours. I'm always impressed by our verbose discussion and ability to occupy time. So I don't doubt we'll use that. And, I'm available to go if need be.
I agree with Kelly. That sounds good.
So that means if our regular meeting ends at 4, we're here till 6.
Right now it looks, but.
Don't ever say that in front of grassroots TV.
Yep.
Let's
Is
schedule it for
everything
2
on the
hours.
current future agenda for next Wednesday? Do we have any more land use that's going to come before next Wednesday?
No. That's why we think it should be pretty short. So we'll go ahead and get time scheduled, and if we don't fill it all, obviously I don't think anyone will be upset by that.
We can leave early.
Yeah. That's all I had for future agendas.
Steve?
Patty?
John, this is going to come as a great surprise. I have no comments on future agendas.
Did you read them?
I read it carefully, and I read it 3 times just to make sure I wasn't missing something.
Kelly?
More of a question than a comment. George, will you be attending in person for any future agendas? I don't know if I'll have a chance to make you a last birthday cake.
Oh, I'll come in for a birthday cake.
You let me know which meeting.
Well, yeah, maybe we'll combine it with my last meeting in December.
Okay.
Thank you.
My birthday's coming too.
Well, you can come in
Okay,
for George's
any
birthday cake.
open discussion, John?
Yes, actually, I'm just trying to open a file here to share with you. It looks like maybe it's not gonna work for me here. So, mostly what I wanted to just reiterate for the community and the board is the state is going through a major surge or spike in COVID cases right now. All of our neighboring counties, two-week incidence rates now have put them in the red zone. So that's over 350 cases per 100,000. We are remaining at the orange level in that metric at just around 260 cases per 100,000. That said, we do expect, we got our initial call on November 3rd that CDPHE was tracking our metrics and that they had noted an exceedance on one of our metrics, which is the incidence rate. We're anticipating a conversation today where CDPHE will be asking us for additional mitigation plans and putting the county on a timeline for that indicator to drop before the county gets moved to the next more restrictive level of safer at home, level 3. We have scheduled kind of a town hall with businesses this Thursday at 10 a.m. We're pushing out a Zoom meeting to talk about what that would mean in terms of additional restrictions that we'd be operating under. Basically, it would mean that our businesses are operating at 50% capacities. For the most part, would go down to 25% capacities, and maximum thresholds would be reduced. Obviously, we're hoping to avoid that. Pickens County has already implemented stricter public health orders than are required under our current level 2, the yellow level from the state, particularly around informal group gatherings. But now is the time for us as a community to really pull together once again and make a commitment to sacrifice our daily routines that mean so much to us in terms of seeing friends and family members outside the household. Most of the spread right now is really continuing to happen at these informal gatherings with multiple households, and so really just asking that we take a step back, we look at November as an opportunity to make the choice to stay home, stay with our families as much as possible, work from home as much as possible, and see if we can get these numbers down before we go into our winter season. That's why I have for open discussion today.
So I wanted to call to the board's attention, there's an email that just came in from Dave Lambert. I didn't read the attachments yet, but the gist of it was his daughter lives in Australia, and they've gone 11 straight days with no new cases in Australia. And they are attributing it to the fact that they figured out that some face masks are way better than others, and everybody started using better face masks and also, I think, wearing them. And consequently, they've been able to Well, you know, they're probably not totally rid of it, but they haven't had any new cases in 11 days. So I think everybody should read the articles that are attachments. They're like newspaper articles from Australia. It should be informative for us. Greg?
Yeah, I may have shared this with you all. I'm not sure. It's just the Colorado Sun had an article today after interviewing people at the Colorado Health Department, and it's regarding testing. 'Cause testing, of course, has been on everybody's mind with all the new testing that's coming around. And basically, the gist of this article says testing combined with austere behavior change can get us out of this. Testing alone of asymptomatic cases isn't going to do it. But it's really a behavioral change, and the testing can certainly be a component of that. But without the actual austerity, behavioral change, social distancing, masks, maybe better masks than we've been using, is really what it's going to take. And I think, I guess we just can't keep repeating that message enough. It has to keep going out.
Kelly?
Thanks. Yeah, I agree with you, Greg. Everywhere has had more testing than we've ever had. And, we are seeing now that it has to be combined with changes to our behavior. I do want to, I have a couple more things to say, but I do want to ask John if you have a testing update for us before we close open discussion. And then, I guess in looking to Thursday's community forum, I would like to just ask, I would like to see some feedback from the business community on everything that they think they can help with or do to help stymie this as well. In particular, I think that we really have to have a tough conversation about visitor restrictions. And, I'm glad Pickens County made the request of the governor about a broad-based traveler requirements for the whole state. I hope the governor revisits that, since he told us that he was not going to impose those, that maybe we will see a change of heart that applies to the whole state of Colorado. But nonetheless, I think we may need to pursue those locally. And I would be curious as to what the business community thinks they can help with in that regard, and what is possible. And if things are not possible, then why not? What their efforts on helping us implement a testing requirement or quarantine requirements or something, what their opinions on that would be. Because, I really think we dodged a bullet in many ways by the timing of how the pandemic occurred in our community. School functionally was reaching a close. Summer allowed for great space for everybody to spread out. And I think we're in a place where we're going to have the harder conversations about, what activities we're going to prioritize in the community and keeping, our populations healthy and safe. And, I just want to point out that for me, one of the scariest metrics I'm reading about is the ICU capacity. 82% of our ICU beds across the state are occupied, and this has broad effects. That affects people who are in car accidents, that affects people who have heart attacks, that affects people who have reactions to surgery or treatments, and if you need to be transferred hours and hours away to a different hospital because that's the closest ICU bed, that affects health, your chances of recovery. And to me, that's one of the scariest things that we're seeing right now is just thinking that the things that you don't plan for are going to crash into what we're seeing with the things we can avoid with COVID. And I hope people just take that to heart. So, those are things I'm thinking about right now. That's a request I put out for Thursday's meeting. And then, John, if you do have a update for us on the testing we're trying to pursue at a community level. Again, it's not the panacea. We have to change our behavior, but we do need better testing. I'm still waiting for my son's test results from last Thursday. And I can understand everybody's frustration.
Before you respond, Steve, can I just to tap on Kelly? So the Board of Health, or the Public Health Department, is redrafting that letter that was sent to the governor to try and get more people to sign on. So once that letter is redrafted, I'm gonna review it, and then I'm gonna take it to Northwest COG to send out to their membership to see if we can get more signatures, because we think that'll have more effect with the governor, which I think it will. But we're waiting to make sure we have a letter that can be more acceptable by all the member jurisdictions. That's number one. Number two, maybe we need to have ACRA come in and do a presentation or something, because ACRA has really been working hard with the business sector, and that may be a good place for us to start with. Bring it to us what ACRA knows the business community is doing, and how we might be able to help ACRA help the business community in doing those things. So I see John making notes. So, okay, John, I'll turn it back to you.
Greg?
Yeah. Oh.
Yeah, just on following up on Patty and Kelly, I think it's very possible the governor is going to give us the same response we had last time, because he's thinking about the entire state. And there certainly are counties and areas in the state that do not have the international tourist reach and universe of people who come, but the ski towns do and the tourist towns do. And I'm just wondering if maybe we can reach out to the ski towns, the other ski towns, the resort towns, the ones that are heavily impacted by visitors from elsewhere, and work on them. Only because rather than saying, let's apply this thing to the entire state, it might be, let's carve out the section of the state where we're getting the biggest impact. And maybe we're not going to catch everybody, but we're going to make it, we might be able to pull something off that works with the governor if he's still hesitating. So just wanted to put that forth as a suggestion, Patty, as you take that forward.
Kelly?
Yeah, and I'll just say, I know the idea has been circulated with the Colorado Association of Ski Town members. And, you know, we're part of CCAT, so they've requested our information on that as well, which is the county base. So I think there is, you know, this idea will be bandied about. I think we need to figure out, in the event that the answer is no, like what is our local ability and response as well. And I really think we have a responsibility there to figure out a path.
Okay, now to John for the testing.
Yeah, so back to the testing question. So yeah, we have two tracks going. The first is leveraging the resources that the state has recently made available through both curative and BINEX tests. And so to date, the county's received 3,000 curative tests, and so these are the oral swab tests. We've placed 2 additional orders. The first for 6,000 curative, and then 3,000 of the BINEX, which is an antigen test. We did that on Halloween, and an additional order of 5,000 curative and 4,000 BINEX on November 3rd. We're still waiting to receive those. The initial allotment of curative tests is being used by AVH now at the Mid-Valley site in Basalt. We are waiting. We are also on the list for a testing kiosk from Curative to collect samples there. We're working with Aspen on locating that. The last communication I had with the state last Friday thought that kiosk was still 7 to 10 days out from being delivered. We will keep you posted. We did receive word from the state that they are not prepared to support the school testing with curative tests through the end of the year, the volumes of roughly 1,800 tests a week. That they're going to give a little bit of time for transition. They are offering these BINEX tests, which are the antigen test. It's a nasal swab test. We're going to be trying to meet with the school district a little bit later this week to talk about how we can continue to support testing strategy at the school to help keep the schools open. But right now there's some I think uncertainty there. There's probably about 2 weeks of supply left for the testing program that the school ramped up. But the BINEX test may be an alternative that will work for the schools. So we'll be having those discussions. I'll be getting you an update. And then for the longer term, we are narrowing in on agreements with Aspen Valley Hospital and COVID Check Colorado to expand testing sites in Aspen, Basalt, and Snowmass Village. These will not require a doctor's referral. And we'll be talking about the costs in those negotiations coming up and how they get spread among the organizations. So Kelly, that's kind of where that update is now. Thanks for prompting me.
George and then Greg.
Yeah, John, it's great news to hear that we'll be getting an influx of new testing. Will we have the capability with our current contact tracers to be able to respond, or will we be back like last spring, where we'll be needing to look for volunteers to help out?
So we actually are, right now, we're doing a surge plan 2.0. We had our initial surge where we had trained 17 people. What we're finding is that we need a regular rotation of an additional 10 people. So we're working in the organization right now, actually starting today, to identify 10 individuals, two each Monday through Friday, who will be dedicated for surge capacity on case investigation and contact tracing. We need that right now. That's with our recent surge in cases and contact tracing. And so we're working on that surge capacity. What we found, George, was there is a lot of difficulty with scheduling volunteers on short notice. When a surge happens, it's not necessarily predictable 24 or 48 hours ahead of time. So we're going back to a secondary strategy and keeping it within county employees. We'll be providing on-call pay and such for those folks who are able to do that.
Thank you.
Steve, I think that, John, at some point, maybe if you don't feel like speaking extemporaneously, I just wanted to say that, so much has happened regarding testing in the last couple of weeks. And of course, the surprise that came when the school district found those tests. I do know that our public health department and the county have been looking and examining, I don't know how many different varieties of tests and testing protocols. And I think it was a matter of timing, the way all this happened. But I wanted to be able to say something to the community so they know that, we've been on this 24/7, looking at every possible possibility for testing and for paying for them. And so it's a complicated issue. It's more complicated than what we're hearing or reading often in the newspaper or elsewhere. So I think it would be good of us to maybe just have a statement for the papers or whomever to say, hey, we are doing this. We're on top of this. We appreciate the help, but this is a multifaceted challenge that we're facing, and it just might be helpful to have an explanation as a suggestion for us, for county, to put out.
Yeah, so thanks, Greg. So just the curative tests that the county has requested from the state, that the cost to the state of those tests is over $1.6 million. And so that's been some of the local challenge. When the curative test, up until really about a week ago, 10 days ago, the curative tests were allocated to counties on a per capita basis. Pickens County received 1,000 of those tests for underserved populations. And so as those tests are paid for by CARES Act dollars, so as we get closer to the December 30th deadline and the state had a surplus of those tests, they loosened up on their requirements, and we appreciate the efforts of the school district in seeing if that would be, a viable option for them. And I think for this first few weeks of testing, it's going to be, it's probably going to need to be a different, due to the complications, as you're pointing out, Greg, that we keep running into. We'll probably have to be a different testing modality, and we'll probably have a request to allocate some of our tests that CDPHE is giving for the community to the schools, which may be appropriate. But we'll be having those discussions later this week to try and figure all that out. So I don't know. That's a start, Greg. It may not be what you're looking for.
No, I think that's exactly what the community needs to hear, because this is a much more complicated scenario, and it's been ongoing for months. So I appreciate that. The only other question I had is regarding curative or the others. What do you think the odds would be that they'll actually have a lab established in Colorado so that we can reduce the turnaround time by half, probably? Because right now those tests need to be shipped to a lab in Los Angeles, as I understand it.
We are not hearing any plans along those lines. One of the attractive pieces of working with COVID Check Colorado is they'll work with multiple labs, and one of the labs that they've added with a saliva test is here in Colorado, so those turnaround times tend to be a lot quicker.
Patty?
Yeah, can I just ask, back to the antibody testing, what's the protocol? Excuse me, who can take advantage of it? I mean, what are we gonna, is it the same test we had on the shelf from earlier this year?
No, so this one's actually a nasal swab test. And it's not antibody, it's antigen. And I'm a little stretched to tell you what the difference is right now. We'll have to have one of our public health folks speak to that.
I can ask the question at tomorrow's public health meeting.
Yeah, but the tests have a lower specificity rate, and they tend to have, so a little bit higher false positivity, a little bit higher false negative, but they are a point of care test, so you get the results back very quickly. It's a swab. It's put on a medium with something dropped on it that helps you.
That's very scientific.
That's very scientific, and it changes color based on what the test is detecting. It does need to be collected under supervision of medical personnel, and so I have to be honest, I need to get a better briefing from our public health team on these tests. We have requested them, and I need to get a better understanding of the process is going to be different for collecting the samples, and what the information you get from the test is going to be different. But it does detect an active infection. It's not like an antibody test that just tells you if you have.
That's the antibody test, the ones we have on the shelf.
No, they're not like those. Which ones do you mean we have?
What are the ones we had that we got months ago that we started using and then put them back up on the
Yeah,
shelf?
so those actually we did distribute to AVH to use in their testing program, and they are an antibody test.
That's
So
what I
they
said,
are a
the
blood
antibody
serum test, yeah.
This is an antigen, the one we've had before is an antibody.
Correct.
That shows if you have had the infection.
Correct, but not if you have an active infection.
And could we maybe, if possible, have the update as part of our public health meeting?
Yeah, there's gonna be
That'd be
a big we only had 5 minutes, so I wasn't planning on going into this
Thank
much
you.
depth with y'all. I see Kelly's got another hand up here.
Kelly?
I was gonna take a stab at just by explaining antigen versus antibody versus the genetic material that the PCR tests for, but I think John did a good enough job there.
Okay.
And his scientific demeanor that he presented it.
Wasn't my best explanation.
Greg?
Yeah, if we're off that topic now, and I know we're about to go to an executive session, just thinking regarding open discussion, regarding the last presentation we had from Healthy Community Fund, I did have some other questions, and it occurred to me that when they come back to us, whether it's in January or whenever, I would love to unwrap a little bit about the partnership and the contracts and our obligations to our partners. And I guess the question I have is, if the activity and the mission changes significantly enough with a partner, to me that seems to be that it may actually change the nature of the contract. And if it doesn't, that's okay. But here's the question was, if we have a contract with them and we're obligated to pay them a fixed fee, then why are we even hearing from them on a yearly basis until the contract is renewed? What's the point? So those are just questions that popped up, and I always think of what I wanted to say hours after the meeting is over. But I thought I'd put that out because I know it's going to come back, and those are questions I'd love to dive into. Thanks.
Patty?
I have a totally separate one too. Discretionary fund. We need to have that brought back to the board before the end of the year, please. So we can make some decisions, and maybe some of these entities we saw today at our Healthy Community Fund discussion, we might be able to help with. I think we have a significant, not a huge amount, but significant amount in that fund for us to utilize it for the end of the year.
Okay, any last public open discussion items? And seeing none, I will call a special meeting. Kelly?
Sorry, I'll take this as my last opportunity to pitch and plug the redistricting commission application that closes today. I have a letter to the editor in the Aspen Daily News with the link. So if you want to be part of our citizen commissions to draw our legislative and congressional boundary lines, please go apply. Today is the last day.
So Kelly, I was all excited about that when I first heard about it a month ago. And I went right out and I got the application, and then I found out right away that elected officials are not eligible to be on it. So it is a very incredibly important thing that we need to get good people to make sure that the job is done right and fairly, because that's going to affect us, our congressional districts, our the state legislative districts, and all of that will be affected by how the lines are drawn.
So Steve,
Today is the deadline?
yeah. So Greg, put in a call to Marky Butler.
Okay, so I will call a special meeting and entertain a motion to go into executive session for the purposes of Basalt Commercial Park rent deferral, open meetings law litigation, easement negotiations Shady Lane, Red Mountain Ranch settlement agreement compliance, Yule Creek Mine Clean Water Act permit, review of application process for Phillips property, potential personnel litigation. All of those pursuant to CRS 24-6-4024B. Also, Cougar Canyon parcel potential sale pursuant to CRS 24-6-4024A. And IGA with Garfield County to house Pitkin Jail detainees. And contract discussion with COVID-19 testing partners pursuant to CRS 24-6-4024E.
So moved.
Patty moved.
Second.
Greg seconded. All in favor of going into executive session, say aye.
Aye.
Aye?
Aye.
Okay, we are in executive session. Grassroots, we are done for the day as far as you are concerned here. And we will meet, we have a different, we need to log out.